Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, everyone, and welcome to 5 to Thrive Live. I'm Karolyn Gazella, and I co-host this show with my good friend, Dr. Lise Alschuler. So, how much do you know about inflammatory bowel disease, or IBD? The first thing to know is that these illnesses are common, affecting millions of people. In fact, in the United States, there are about 70,000 new cases diagnosed each year. Fortunately, I have the perfect expert to help us with this topic. Dr. Mark Davis is a naturopathic physician who specializes in the treatment of IBD. I've worked with Dr. Davis a lot over the years, and he is top notch. In addition to his successful clinical practice, he teaches gastroenterology at Sonoran University of Health Sciences, and he is on the board of directors of the Gastroenterology Association of Naturopathic Physicians. But before we start our conversations, I'd like to thank our sponsors, beginning with Cetria, a patented form of glutathione, clinically proven to raise blood glutathione levels. Glutathione is the master antioxidant and the body's primary defense against free radicals. It also helps support respiratory health. For more information, visit cetriaglutathione.com. Also, cognizin citicoline, which is nature's way of keeping the brain's energy-producing centers firing on all cylinders. If you're looking for a way to enhance your brain function, including memory, focus, and attention, look for cognizin on the label or go to cognizin.com for more information. ProThrivers Wellness Brain is a product that contains cognizin as well as other brain-supporting nutrients and herbs. You can find ProThrivers Wellness Brain online at pureformulas.com. There's also ProThrivers Wellness Sleep, which combines higher dose melatonin and other sleep-supporting natural ingredients specifically designed for thrivers. You can find ProThrivers Wellness Sleep at pureformulas.com. And Dr. Ohhira's Probiotics. It's a best-selling probiotic for more than 30 years, and it contains 12 probiotic strains that are shelf-stable, so no refrigeration is required because of a unique 3-year fermentation process. It's a very effective probiotic. Learn more at drohhiraprobiotics.com. Dr. Davis, thank you so much for joining me.
I am so excited to be here. Thank you for having me.
Yes, and I actually would like to start with the basics. Tell us what inflammatory bowel diseases are. Give us the medical definition.
Okay, great. So there's two major kinds of inflammatory bowel disease, or IBD, and that's ulcerative colitis and Crohn's disease. About 0.5% of people in the United States have each of these. So about 1% of people in the United States have inflammatory bowel disease. And these are chronic autoimmune conditions that lead to inflammation in the intestines and often have ulcerations, so deep inflammatory lesions in the intestines that can lead to pain and bleeding. And there is a genetic risk for each of these, but it's not a simple genetic cause. There's not like one gene that causes it. There's over 150 known genes that can be activated in different ways to elevate risk. And that genetic risk interacts with the environment to give people symptoms or not.
Okay, so remind us about what an autoimmune condition is. What's the general description of an autoimmune condition?
So an autoimmune condition is where your immune system that's supposed to attack pathogens and foreign invaders and things that could threaten you makes a bit of an error, and it ends up attacking your own tissues. And so for ulcerative colitis and Crohn's disease, it's a little bit of a funny thing where they're kind of attacking normal, healthy bacteria that can't cause us harm. And they end up harming your intestines kind of as collateral damage.
Yeah, we've done a lot of shows on autoimmune conditions. It seems like these IBD conditions can be difficult to treat. Why do you think that is?
Well, there are a few reasons for that. One is they can be pretty severe. So common things like IBS can really mess with your quality of life, but they're not going to end you up in the hospital. But ulcerative colitis and Crohn's disease can be really severe. About 25% of people with ulcerative colitis end up needing an intestinal surgery at some point, and about 75% of people with Crohn's will need at least one intestinal surgery in their life. So anything that is severe like that, or even can be life-threatening, is hard to treat. Another thing is they're not that responsive to conventional medicines. So I'm a naturopathic physician, and I love using all of our natural tools, but I love for my patients to have the best of all the conventional medicine tools available out there too. And this is one of the conditions, or these are two of a set of conditions that we do not have the best tools to control them. Maybe 50% of people on a really good day are going to be in a long-term response with the best conventional medicines out there. So that makes it difficult to treat. And I guess if I had to pick a third thing, I would say that they're both, ulcerative colitis and Crohn's disease are both naturally waxing and waning. So sometimes you're worse, sometimes you're better, and sometimes that has to do with diet or stress or other things. And sometimes it's just for reasons nobody knows. And so once people get in a little bit of control, when things are waning and they're feeling better, it's people stop there and say, okay, I'm well enough now. And they don't go deep enough to get into what's called deep histological remission. So that's a whole spectrum of reasons that IBD can be difficult to treat.
Yes, it is, and it's can be difficult to diagnose as well, right?
Um, yeah, people will go a year or two sometimes with symptoms, or it can even be longer before they get a diagnosis, or otherwise the diagnosis happens right away. So the only way to definitively diagnose them is through colonoscopy, where you go in and you take a look with the colonoscope and you say, aha, this is some inflammation that looks like ulcerative colitis or Crohn's. And then you take biopsies and send them to a pathologist, and they say, yes, this is ulcerative colitis, or yes, this is Crohn's disease. Or sometimes there's something about 10% of the time called indeterminate colitis, where it kind of has characteristics of both. And so that's when you get the definitive diagnosis. And I have patients who get symptoms and they're diagnosed correctly within a week. So it can be quick, can be a long time.
Got it. Okay, so what are some of the primary symptoms of IBD, and how do those symptoms impact quality of life for the person who has the condition?
Yeah, great question. So I would say diarrhea is the most common symptom. Frequent, loose stool, often urgent, sometimes so urgent that there can be fecal incontinence, often so much inflammation that along with excreting stool, you're excreting mucus or blood, sometimes so much blood that my patients have needed blood transfusions, and pain. So abdominal pain is another big one. Diarrhea is more predominant with ulcerative colitis, and severe abdominal pain is more predominant with Crohn's, but it can be either way. And I've had patients with constipation or with no pain. So a wide spectrum of pictures. And then there are times, especially with Crohn's disease, where the inflammation can be so severe that the intestines narrow. That's called a stricture. And that can cause blockages. And that's when you need an emergency surgery. Or when we develop abscesses or what are called fistulae, when there's an inflammatory tunnel from the intestines out to like another organ, like the bladder, and then you get bladder infections. I should also mention there are what are called extraintestinal manifestations. So sometimes the inflammation in the gut can cause inflammation in the joints, so people have joint pain, or in the eyes, so people can have what's called uveitis or iritis that can cause vision damage, or the liver or the kidney or the lungs or other places. So big spectrum. And I would say the inability to get out of the house is the most frustrating way that impacts my patients' lives. When you're having 10 or 20 urgent bowel movements a day, it's hard to feel comfortable leaving the house and going to special events or going on vacations unless you know right where the bathroom is. So,
Wow.
yeah.
Yeah, I mean that when you're talking about quality of life, and when you're talking about that, those types of symptoms and manifestations of this illness, I can see where this would be very troublesome. So let's dig into your self-care strategies. Why is self-care so important, and where do you like to begin with your patients?
Okay, so with my patients, we always start by giving the big picture where I say there are 5 steps of care. And step number 1 is always making sure that you are safe outpatient. And this isn't just for me in my clinic. I recommend IBD patients think about these steps anytime they're getting care from their gastroenterologist, their primary care doctor, their acupuncturist, their naturopathic physician, anybody. So step number 1 is, are they safe outpatient? And sometimes people come to my office and they have a visit and I have to say, I'm really not the best fit for you. You belong in a hospital right now. I'll work with you when you get out of the hospital. So that's step 1, ensuring safety. Step 2 is ensuring clinical remission. And that means no symptoms or barely any symptoms. And unfortunately, that's where a lot of people stop. And that's one of the reasons it's so difficult to treat is gastroenterologists and conventional doctors and naturopathic doctors sometimes say, oh my goodness, I'm so happy you have no symptoms. We're stopping there. I consider that to be step 2. Step 3 is called serological remission. And serology means blood tests. So for us, that means all of your blood tests and stool tests show that you're not having excessive inflammation anymore. Step 4 is histological remission. Histology means tissues, and that means colonoscopy and biopsies show all the tissues are totally not inflamed anymore. And then step 5 is maintenance, which means getting regular blood and stool tests to make sure there's no inflammation starting a little bit again. So that's where I always start is saying, whoever you're working with, make sure you're working at the right level of care and aiming for the deepest levels of remission. And then my big next step is to get to know the patient and their values and their health aesthetic and what their life is like. Because there are so many tools, really dozens and dozens of helpful tools for people with IBD. And some people say, if I can just change my diet and get into remission, that would be the best thing in the world. Tell me what to do, and I will change my diet to exactly as you say. And they love that. Other people say, the last thing I want to do is change my diet. Can we do anything else? So you really have to know the patient's values and preferences and their life and what they want. Do they want to avoid drugs at all costs? Do they want to use the newest experimental drugs at the first time they're available? What's their budget like? Are they willing to accept some more risky drugs or herbs or therapies for chance of higher benefits? So there's so many things to do to get to know the patient. And that's where I like to start out with them.
So from a naturopathic perspective, are your main tools diet, lifestyle, and maybe dietary supplements? What are your the main tools that you kind of go to for a lot of your patients?
Exactly what you said is hugely important. Diet, lifestyle, and dietary supplements. I can talk about some specific ones if you're interested, but also I'll throw out there herbs. Herbs are a kind of supplement, but sometimes we're using them as teas or as tinctures, and they can be hugely important tools. I also work a lot with this very unusual therapy called fecal microbiota transplantation, otherwise known as FMT or fecal transplant. That can be hugely important for some people with IBD. And I work with another one called helminthic therapy, which is basically a special, unusual type of probiotic. And then sometimes, as naturopathic physicians, we're prescribing certain drugs off label. One of my favorites is one called low dose naltrexone that is used for people with a lot of inflammatory conditions and not used by conventional gastroenterologists, but really helps some of my IBD patients.
All right, so let's take me through, and I love the fact that you have this expertise in FMT and dietary supplements and herbs and everything else. But take me through from a dietary standpoint. I'm particularly curious if FODMAP or some of these diets. Do you recommend them? Do you use, or do you just go with more of a whole foods Mediterranean style diet? Talk a little bit about diet first.
Well, there have been a lot of different diets studied for IBD, and actually Mediterranean diet and FODMAP, low FODMAP diet, both have been studied to show some benefit for people with IBD, which is great. Actually, there are so many diets that can be helpful, and you never know which one will help the individual in front of you, that I tell people, I give them a list and basic descriptions of a bunch of different potentially therapeutic diets. And I say, look, these are very different, and some are going to fit with your lifestyle better, and some aren't. My two favorite diets, actually, for people with IBD are complete opposites of each other. The first one is called specific carbohydrate diet, and that is a diet that has no grains, initially no beans, and never has soy, and includes lots of meat and fish. And the only dairy it allows is a special 24-hour fermented yogurt. Another of my favorite diets is called the semi-vegetarian diet, and that is a diet where you have rice at every meal. The specific carbohydrate diet allows rice never. You have miso soup every day, which is a diet invented by a Japanese gastroenterologist, so that's why it's such a specific diet that has miso in it. But that's soy, which is never allowed in the specific carbohydrate diet, and you only have meat about once a month and fish about once a week. And you have lots and lots of vegetables, including fermented vegetables. So these diets are very different. And I tell people, if you're the type of person who can leave grains behind and you just want to eat meat all the time, let's start you on this specific carbohydrate diet, because it'll be a good fit for your life. And we'll see how it affects your biomarkers, CRP, fecal calprotectin, and other biomarkers that measure inflammation levels. If you're the type of person who would rather avoid meat and you would like to have a vegetarian lifestyle, let's start you on a diet like that. That's a good fit for your life, and see how you do on it and tweak it from there.
So it's highly individualized.
Highly individualized. There is no single food that is quote unquote safe for every person with IBD. And there's no single food that is dangerous or increases risk of inflammation for every single person with IBD. I can think of a patient of mine with very severely active ulcerative colitis who had some dietary triggers. And he said, the worst of them are lettuce and garlic. If I have any lettuce or garlic in my diet, I am sure to see blood in the toilet the next morning. Whereas many of my patients can tolerate those foods just fine. Some people do very well on a high meat diet. I've had other people that cannot tolerate any meat, or they will have rectal bleeding. So hugely individualized.
Yeah, and it's got to that I mean that has to add to the challenge of the treatment protocol that you're creating, because every patient seems to be presenting differently.
Yes, that is true. There are some ways we can help dial in what the best diet is if somebody just doesn't want to pick a blueprint. One is blood testing for food sensitivities,
Mm.
IgG, IgE food sensitivities, or especially I like one called IgG4 food sensitivities that's been tested in people with IBD. So doing that kind of testing can give you a bit more of a roadmap of what things to avoid or what things might be safe. And then there's the difficult but rewarding elimination challenge diet, where we take you down to just 2 or 3 or 4 basic foods and see if that really enhances remission. And then we add foods in, a new food every 24 to 48 hours, to see if you react to them negatively. So it's a long, laborious process, but it can be really rewarding for some people.
Mhm. Okay, so let's switch to lifestyle. When I think about lifestyle and I think about conditions such as this, autoimmune, inflammatory, I think about stress and I think about sleep. Do those two bubble to the top of your list as well?
Yes, absolutely. So higher stress definitely can influence flares and make them more likely to happen, and lack of sleep is the same. And when you look at surveys, sleep can be a challenge, and being overstressed can be a challenge as well for people with IBD.
Mhm.
So that's pretty individualized too, in terms of what the best tool is for a given person to reduce stress levels and get good sleep in. Um, we use a ton of different tools. I love some nutraceuticals and botanicals, and certain rituals around sleep can be helpful. Um, and for stress, I'm a big fan of yoga. Inflammatory bowel disease often can decrease bone density as well. And so there's a great book called Yoga for Osteoporosis that I recommend a lot that can also help with stress management. And then there are other things like air pollution, air particulate matter is linked to frequency of IBD flares. So sometimes where you live or what sort of air purifier you have can help. Microplastics are a risk factor. So cleaning up diet and making sure you're eating more whole and organic foods. So a lot of different potential aspects of lifestyle to address.
Yeah, what about exercise? You mentioned yoga. Is there any limitations that one may have when it comes to exercise in general, or is exercise just, almost always recommended?
So during a moderate to severely active flare, we don't encourage exercise because it's just such a toll on the body to be having a lot of inflammation in the gut and bowel frequency and losing blood for most people that we don't encourage a lot of vigorous exercise during that time. We tend to recommend more rest and recuperation type attitude. But for people who are only mildly or sometimes mildly to moderately active or who are in remission, exercise does tend to decrease risk of flares a little bit. And the truth is, even though IBD makes you suffer, the vast majority of people in 2025 do not die of IBD. They're dying of other things. And because they tend to have more inflammation, people with IBD do have somewhat increased risks of cardiovascular disease and other things. So I'm really encouraging exercise for a long, healthy life for people for other reasons not directly related to their IBD diagnosis.
Yeah, that makes a lot of sense because there is comorbidity with these conditions that you have to manage as well, in addition to symptom management, in addition to this particular condition. So that makes a lot of sense. So let's go back to dietary supplements. You mentioned low dose naltrexone, and take me through your probiotic philosophy when it comes to IBD.
Okay, awesome question, because we group ulcerative colitis and Crohn's disease into this category called IBD, and they're very, very similar in some ways, but they're also very different in some ways. One interesting way is their response to tobacco. Tobacco flares people with Crohn's disease, but quitting smoking tends to flare people with ulcerative colitis. So when I have smokers, I say, we want to get you out of smoking tobacco, but not until you're out of a flare, because it's going to make things worse. So that's a way in which they're opposite. And another way is probiotics. So probiotics are usually very beneficial for people with ulcerative colitis in a dose-dependent manner, where I will dose hundreds of billions to low trillions per day. Very high dose lactobacillus and bifidobacteria probiotics. And the literature supports that. I've seen it in my patients, and it's clear in randomized controlled trials and meta-analyses. Regular lactobacillus bifidobacteria probiotics help. I have had occasional patients with Crohn's who say probiotics help, and I believe it. Every individual is different. However, the literature shows that probiotics versus placebo are not different for people with Crohn's. And there was one trial actually where the people in the probiotics group did significantly worse than the placebo group. So in terms of our most common probiotic, lactobacillus and bifidobacteria probiotics, I generally do not recommend them for people with Crohn's, and I recommend them strongly for people with ulcerative colitis. There's a lot of other great probiotics out there that I like to use. One is E. coli Nissel, otherwise known as Mutaflor. That is a great one. There's an originally Japanese one. Now it is available in some products in the United States called Clostridium butyricum. Produces butyric acid, which is anti-inflammatory. That's a great one. So there's a bunch of different probiotics, but the most common ones I dose high in ulcerative colitis and generally avoid in Crohn's disease.
That's fascinating to me, Dr. Davis, because here we have two conditions in the same category, basically, and they're you have to treat them so differently. And I feel like that's why you need an expert. You need a specialist in this area. because it is so highly individualized.
Yeah, agreed. I see a lot of my non-specialized colleagues in naturopathic medicine providing an awful lot of benefit for people with IBD too. So I think you can see any naturopathic doctor who's close to you, even if they're not specialized. But often those colleagues will refer their trickier cases to me, and I'm always delighted to see them.
Yeah, and are there any other dietary supplements that you want to mention just briefly before we wrap up?
Oh, wow, so many. So I'll try to be concise. I test my patients a lot for vitamin D and zinc and selenium. Those are three super important ones to know what their levels are and give it to them if they're low. If they're on prednisone, which they often are, I always give them a supplement called DHEA to complement that and reduce side effects. There's for people with Crohn's especially. Let me throw out one of my favorites is called N-acetylglucosamine. Can stop or slow down, or in some cases even reverse the stricturing process, that narrowing of the intestines due to inflammatory scar tissue being laid down. So I love that one. Oh, and for my ulcerative colitis patients who are severely active, there is an herb that is amazingly effective and does have a small amount of risk. So I like it to be managed by an expert, called Qing Dai or Indigo Naturalis. So those are some of my top supplements, but there are many.
Yeah, that's great. It sounds like you do have a lot of tools in your toolbox when it comes to treating this very, very complex illness. So, where can listeners find out more about you? Do you have a website that you'd like to share?
Yes. So myself and two colleagues treat almost exclusively inflammatory bowel disease. We're at Foundational Medicine. Our website is foundational-medicine.com. And we're licensed in Arizona, California, Colorado, Washington, D.C., Massachusetts, Maryland, Oregon, and Vermont between the three of us. And we see people with IBD from all over.
And you do telehealth through Foundational Medicine, correct?
Exactly. Yep. So we're licensed in all those states. People in Maryland can come see us in person if needed, but mostly it's telehealth. And we do have a course there. It's a 12-hour course, costs the same amount as one initial visit with us. And it's 12 hours of the material that we've spent decades telling people about. And the most important things that we want people to know about: diets and drugs and labs and imaging and herbs and lifestyle and everything like that.
And it's foundational-medicine.com.
Exactly.
Yeah, I highly recommend listeners, if you or someone that you love is struggling with IBD, go to foundational-medicine.com. This is an amazing work that Dr. Davis and his colleagues have devoted their professional careers to. So definitely foundational-medicine.com. Dr. Davis, thank you so much for joining me today. This was great.
Yes, so great to be here and great to talk to you as always.
Well, great. So that wraps up this episode of 5 to Thrive Live. Once again, I'd like to thank our sponsors: Pro Thrivers Wellness Sleep, Cetria Glutathione, the superior glutathione to support liver and immune health, Cognizant Citicoline to enhance memory, focus, and attention, and Dr. O'Hara's award-winning shelf-stable probiotic. Thanks for listening. And remember, you can find past shows at ithriveplan.com or wherever you listen to your favorite podcast. That's ithriveplan.com. May you experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.